Physical medicine and rehabilitation is a nice blend between musculoskeletal and neurologic medicine. We care for the whole patient and their families, and specifically in my role in pediatric physiatry is looking at a patient, and as they're meeting their developmental milestones, I work with a team of rehabilitation specialists to help recommend what they might need to be as active and independent as they can be. I care for patients even from when they're born all the way up to their young adult years, looking at their functional abilities and keeping them active and being kids as best we can. I think one of the key points that made me interested in physiatry in general and then pediatric physiatry is the team approach to patient care. For pediatric physiatry, I might see patients with congenital difficulties. I might see patients with concussion injury or a traumatic brain injury. I also might see young babies that have weakness in their arm, helping to rehabilitate them with their therapy team. We work closely with different specialties such as pediatric neuropsychology to help make recommendations for return to learn, return to school. It's a very broad scope of patients from inpatient setting, outpatient setting, some procedures to help with tone management, and then working together with their outpatient therapists and pediatricians. I like to ask them about different activities or hobbies they enjoy. I think it's nice being in a pediatric clinic when you can provide stickers or make a glove into a butterfly that they can kind of follow around the room, also looking at their eye movements and motor skills too, while also having them be a kid and have fun with something too. So I think I can assess them both from observation a lot for my exam, as well as history taking from the patient's family or guardian, and then also just seeing what the patient's doing and moving and functioning and how can we help with that. We work closely with multiple different specialties, which is the aspect I like the most about it, that we can collaborate and work together to see what are the unique skills that we need to implement to help the patient in that situation. I think it's a continuum of care that rehabilitation plays a role in with physiatry, especially pediatric physiatry, trying to anticipate what changes might happen as the patient ages or grows, what different therapies can help strengthen them as best we can before they go into that to hopefully optimize their cardiac and pulmonary function after a procedure, for example, or how they're going to function post-care. While I've been here, I feel I can see it active and live, the mission and vision of the hospital of caring for the patient, and how PM&R can play that role is because we take a very holistic approach and we're seeing patients from all different stages of their recovery, or how can we grow and develop those models of care to optimize function. I think that's been the rewarding thing that I've seen us play that role in that piece and make WV medicine a special place.